I'm Tracy Foster, and I'm with Maryville University, and I'm going to be performing an abdominal assessment. Taylor is over the age of 16, and she's agreed to be my patient today. Taylor actually emptied her bladder before we started, and I've got her laying supine here with a pillow behind her head to support her head and neck. Okay. First, what we're going to do is we're going to perform inspection, and with inspection, we're actually going to look at the contour, make sure both sides are symmetric. Make sure there's no protrusions. We're going to look at the skin characteristics like the venous, if there's any venous pattern, like that would be any protruding veins. We're going to look for any scars. We're going to look for any surface motion, and that would be down here if there's peristalsis going on, that you could see that. A lot of times you can see that in a thinner person or a younger person. Don't see anything like that. I'm going to have Taylor raise up, okay, and as she's okay, and then lay down. And as she was raising up, I was looking to see if there was any herniations or any protrusions. Her umbilicus is midline, it's inverted. There's no any protrusions around it. We was looking for any separation in the abdominal area and didn't see any of that. So everything looked normal. Okay, next what we're going to do is we're going to move on to auscultation. Okay, so when we auscultate, we're actually going to use the diaphragm and the stethoscope. Okay, and we're going to start at the ileocecal junction, and that's normally where the vowel sounds are more prominent. So we're going to start there, and we're going to move up to the right upper quad, to the left upper quadrant, and the left lower quadrant. Okay, and as we're doing this, we're going to listen, and the normal sound should be about 5 to 35 beats per minute. If we didn't hear sounds, if they were absent, then we would listen for a full 5 minutes before we could actually make the determination that they were not there. Okay, and while we're auscultating, we're going to auscultate and have her take a deep breath while we're listening to the liver area, okay, and over the spleen area. And what we're listening for here is any friction rubs, and I didn't hear any friction rubs. Then we're going to take the bell of the stethoscope, and we're actually going to put this over the aorta area, and we're going to listen to the aortic artery. Then we're going to listen bilaterally to the renal arteries, and then bilaterally to the iliac arteries, and then bilaterally to the femoral arteries. And what we're listening for here is any bruits, and we didn't hear any bruits, so that would be a normal finding. Okay? So that concludes the auscultation part of the assessment, and we're going to move on to the percussion part of the assessment. So in percussion, we want to make sure that we're listening to the tone, and what that means is we're listening for the tympanic sound, which would be over the abdominal area, and if you're hearing any dullness, that would be over any major organs, or it would be if you had any masses or anything that you heard in the abdominal area, so you're going to be listening for that. So we're going to start first, and we're going to do the abdominal area. We're going to take our non-dominant hand, okay, and then we're going to take our dominant hand, the middle finger, and we're going to strike it twice on the other hand, and we're going to move around the abdomen, and we're going to do this listening to the sound, and we hear this tympanic sound. Okay, don't hear any abnormal findings. Okay, after we do that, we're actually going to percuss, and we're going to estimate the liver size. And what we're going to do when we estimate the liver size is we're going to go below the right lung in the midclavicular area, and we're going to start percussing, and we're going to go until the dullness quits. Okay, so when we start percussing here, we're going to go down until it quits, and we're going to mark that area. Then we're going to go down in the midclavicular line at the umbilical area, the umbilical line, and we're going to go upwards. Okay, and this time we're going to go until we hear the dullness again, and we meet the dullness, and we're going to mark that area. These two areas mark the superior and inferior borders of the liver, and we're going to measure this area. And this area should measure between 6 and 12 centimeters, okay, which would be a normal finding. Then what we're going to do is I'm going to have Taylor take her arm and turn on her right side. Give herself a little bear hug there. And I'm going to actually percuss the spleen. And the spleen is going to be in your mid-axillary area, and you're going to percuss between the 6th and the 9th rib area, okay? And I'm going to percuss down through here. You can hear the dullness. And then when the dullness stops, if it goes past the 9th area, then you would suspect that you had some spleen enlargement, okay? So I'm going to have her lay back down here, okay? Next, what we're going to do is we're going to percuss, and we're going to look for a gastric air bubble. And how we look for that is we go to the left lower anterior rib cage in the left epigastric area, and we're going to percuss. And as we're percussing that area, we're going to move on down, and there should be a difference. The area with the gastric area here should be more of a low-pitched dull sound, and then when you get in the abdominal area, it's going to be more tympanic, okay? Next, what we're going to do is I'm going to have Taylor sit up, and I'm going to percuss the kidneys. okay? And when we percuss the kidneys, we're going to go to the costal vertebral angle, and we're going to put our non-dominant hand, and we're just going to give a quick thud, okay? Both sides, okay? Did you have any pain with that?
No.
Okay, Taylor should feel some pressure, but she shouldn't feel any pain with that for the normal finding, okay? Okay, so that concludes our percussion piece of the examination, and we're going to move on to palpation. And with palpation, we're going to do what's starting out with a light and then go into a deep palpation. And as you're doing the palpation, you always want to look and observe the patient for any guarding or tenderness noted, that if she's flinching or if she says she has some tenderness, okay? So I need you to let me know if you have any tenderness when I'm doing this, okay? So I start with the light palpation, and we're going to move around to all 4 areas. Okay. Any tenderness?
No.
Okay. And what we're looking for in here is any kind of muscle resistance, any bulges or masses as we're palpating this area. That's what we're feeling for. We're also looking here at the umbilical area to make sure there's no masses around that.
Mm-hmm.
Then I'm going to go into a deeper palpation. Same thing. We're going to move around the abdomen, watching the patient for any guarding or flinching. Any tenderness noted?
No.
Okay. No, nothing noted here. Didn't feel any masses or anything. As we're doing this palpation, we're going to also palpate the liver. Okay, so when we palpate the liver, it should be about 3 to 4 centimeters below the costal margin. Okay, I'm palpating that around through here, and you can feel that. Okay, and then when you get on the other side of the liver here, just behind the liver is where the gallbladder is located, and normally you don't feel that. If you do a deeper palpation, and if you feel the gallbladder, then that could indicate that there's some problem going on with the gallbladder. Same thing with the spleen. It should not be palpable, so you're going to be over here palpating at the mid-axillary line, and it's going to be again between the 6th and the 9th rib, and you're going to palpate that, and if you feel anything, then you would suspect that there was a problem with the spleen. Okay, next what I'm going to do is I'm actually going to do is try to see if I can palpate the kidneys, and I'm going to put my left hand underneath her flank area here, and I'm going to take my right hand, and I'm going to actually palpate here, and I'm going to feel, okay, right here below the costal margin. Okay, and as I'm pushing up from behind and palpating deeper here on the anterior side, I'm going to have Taylor take a deep breath, okay? And as she's doing that, if I can feel the kidney, it should feel like a little ball just right round, and it should come in between my 2 hands. Maybe feel a little bit there. If you feel on the left side, however, you may not feel anything over there because it's less palpable on the left side as it is the right side. Okay. Last, what we're going to do is we're going to look and see if we have any aortic pulsation. Okay, so how we're going to do that is we're going to go midline here, a little bit slightly left of midline. Okay, and when we're palpating, we're going to palpate deeply. And if we feel the aortic pulsation, if it's prominent, we're going to have to determine the direction of it. Okay, and we want to make sure if we have any indications of problems there. Okay, all right, and that concludes our abdominal assessment. And thank you, Taylor, for your support.